You are tuned into the Dr. Tina Show with Dr. Tina Moore. For more, visit drtyna.com. Dr. Amie Hornaman, thank you so much for coming on the Dr. Tina Show. Welcome. And I'm so excited to have you here finally.
Thank you, Tina. You know I love you and your audience. We'll definitely give them what they need today.
Well, we are friends in the real world. And so this is a real treat that I get to have you on and we get to talk about your new book, Thyroid Fix. It's been a long time coming. I've been friends with you while you've been writing it, and I'm so excited and proud of you. And congratulations.
Thank you. You know, it's decades in the making. I mean, you know, we're waiting on a book from you too, but it's all of that information that you have that you talk to people about, but you're like, I got to put it all in one place because I can't help every single person individually, but we want to help everybody that we possibly can. And this book will do that.
I love it. And I'm such a huge fan of your work and of just thyroid health in general. If you were to ask any of my colleagues in Portland back when I was starting practice, they would sort of in a nasty way, several people have said like, Dr. Tina just gives everybody thyroid. And I'm like, yes, I do. And you're the first person I met when it's like, why don't you you're like, why are we not starting there? Why are we not starting with the thyroid? Because it's the most obvious. So, but first I want you to share a little bit about you because I started reading your book and I realized there was a backstory there that I did not know. And I love it. So I was hoping you would share with your audience how you got here.
Absolutely. So like many people listening or like many people that have gone through any kind of health situation, I was in the conventional medicine system getting disappointed. So, and you know, the scary thing is it's not even different today. So I'm backing up about 25, 30 years ago. And I was in my 20s. I was competing. I was doing figure competitions, which is kind of like bodybuilding, but more feminine. I was doing fitness modeling. I was doing powerlifting. Like I was doing all the things. So I was eating clean, regimented, structured, disciplined, going to the gym a couple times a day. Sometimes, you know, you go in the morning to do cardio, you go in the evening to lift and do more cardio. I mean, I had the whole plan laid out and I had done plenty of shows before. So I knew how my body was going to respond or was supposed to respond. And, you know, I had a coach too. So checking in with the coach, sending before and after pics, sending my weekly weigh-in check-ins. This one show that I'm getting ready for was a national level show. And every time I stepped on the scale kept going up. And I don't mean like a little bit. I'm talking 5 pounds, then 10 pounds, then 15 pounds. Once it hit 25 extra pounds, I just stopped getting on it because I'm like, I don't need more information here. There is something going on with my body. There's something wrong. And I just need an answer. Now, through that time of the scale going up, I was also tired. I was also losing my hair. But, you know, as a woman, and especially as a woman who takes care of herself, I was most concerned about my clothes getting tighter and that scale going up while I'm doing all the things. And I hear this to this day from my patients. I'm doing all the things. I'm doing all the things right. Why is this happening? Well, I thought the same thing. So I went to my doctor because that's where we all start. And I said, you know, here's what's going on. I handed him my food journal. I wanted him to see exactly how I was eating. Chicken, broccoli, asparagus. I counted every calorie, every macro. And he looked at that and he ran some tests. It says, you're normal. Everything is fine. Now, I don't know what tests he actually ran. I can guess. And I talk about that in the book. It was probably just TSH, maybe a free T4. It wasn't the full picture. But at the time, I didn't know that. I didn't know what to ask for. I didn't have books like we have now. We didn't have podcasts. We barely had the internet. So I kept going. I said, thank you. I don't feel normal. I don't feel fine. I'm going to go for a second opinion. That second opinion turned into a third, fourth, fifth, and sixth opinion. Every single doctor told me I was normal, fine. One of them told me to eat less and exercise more. Like, dude, that's just impossible to do. Like, that's impossible. So, I mean, I'm shortening the story, but I fell into a very deep depression. I was frustrated. I was depressed. I was hiding my body. I mean, really, I had lost a piece of my identity because I was known at the gym as the fitness girl. You know, people would come to me for advice. And now they're looking at me as my body's expanding and basically whispering behind my back, like, ooh, she can't stay on her diet. She's eaten too many donuts. And that wasn't it. I was still doing all the things. So it literally took to the seventh doctor. The seventh doctor actually touches my throat and says, swallow. First doctor to lay hands on me. And she says, I'm feeling a nodule on your thyroid. And we have some tests over here that indicate you have Hashimoto's. Here's a pill. So she gives me this pill. It's Synthroid, levothyroxine, T4. And, at the time, again, I was excited. I was like, I got a name for now what's going on with me. And I have a pill that's going to fix me. So I left her office totally pumped up, thinking finally my life is going to change. I took that pill for 5 months and nothing changed. Nothing. I didn't lose a single freaking pound. Nothing changed. So I did go back to Dr. Google. I powered up my dial-up gateway computer and I start researching. And I see, oh my gosh, what she gave me is T4. That's the inactive thyroid hormone.
Yep.
There's this active thyroid hormone called T3, and there's all these other thyroid treatments like NDT, and then you can add liothyronine, which is T3. Oh my gosh, there's all this other stuff that we can do. And I was so excited, and I brought her this information. I'm like, I'm taking the inactive thyroid hormone. Here's the active thyroid hormone. Can't we do that? And she says, no, that's not standard of care. I don't do that. And I said, well, thank you. I'm going to find someone who does. That's ultimately what led me into functional medicine. I found my mentor, the man who saved my life, who sat with me for 90 minutes, did all the testing. I mean, like that, how we test right now. It was like a book. It was like a book of tests, right? And he's going through it all, explaining to me how my body works and how my thyroid is working and how I don't convert T4 to T3 properly. And he really gave me my life back. And so that's what led me to change careers. I mean, I was already in the health and fitness space, but I went deeper. I went and got my master's in clinical nutrition. I got my doctorate in clinical nutrition. I trained in functional medicine because I never, even at a young age, I had that thought in my head, I never want another woman to have to go through what I just went through. And so I knew then I wanted to build a practice where we could help people in as many states as possible. So now we can prescribe in all 50 states, which I'm super proud of. I'm super happy about because I want to be able to reach every single person that needs it.
Well, it's so crazy that it has been this way for so long because I have been treating that way for decades. And my mentor taught me that back in the 90s. He taught me, in the 90s, I remember him telling me how the TSH lab test was don't allow anybody ever to say your thyroid is normal based on just that marker, which is what most doctors run. They just run a TSH. If you're lucky, you get a free T4. And he taught me everything about thyroid. And then I really geeked out on it because I had a very similar story, except mine did not present as well. I take that back. I did have some periods where I was gaining a lot of weight, but I wasn't nearly as active or hyper focused on it. You were literally doing it. I was in college, and my weight has always been something that's been really easy for me to keep in check. Mm-hmm. So long as I put some effort in, it doesn't have to be a ton. I have to be cognizant of what I'm eating. And I guess way more than the average person, but, that I focus on that. But I'd always had such an easy time just getting the weight off. And I blew up in college. I was taking, I had been diagnosed as manic depressive, and I was being given high doses of lithium for mania. And I would swing from a size 4 up to a size 10, down to a size 4, up to a size 10. And it was somewhat seasonal. And every single time I'd get really, really skinny and really, really happy. And I was having the best time. And it was always spring. So I know there's some circadian rhythm to this. And when you live in a state like Oregon, or I guess any state really that has seasons, like distinct seasons, I really find that for myself and for my thousands of patients, that those seasons impact the dose needed to keep them happy and healthy. It changes from season to season. Yep. And so the lithium on top of it makes you hypothyroid.
Yeah.
And my boyfriend left me. He cheated on me with my best friend. And I was so depressed because every time I would have that really skinny, quote unquote, mania, I knew what was coming after it was going to be the fall. I mean, I was just going to crash out and I was going to gain weight and everything was going to be awful. And this just kept happening. And so I had bins of clothes in my closet that were 4 to 10, all the way from size 4 to size 10. And finally, somewhere in naturopathic school, I kid you not, Amie, I was all the way like decades later, I'm in naturopathic school. My mentor who I worked with didn't even catch it. Nobody caught it. And I end up in, this is after I have a baby. I go through severe hypothyroidism with the baby. I mean, that was all just it was like 10 years of severe hypothyroidism at this point after having my daughter. I'm in naturopathic medical school. I'm in clinic. I'm a secondary in clinic, and in comes this beautiful student. She's so gorgeous. She should have been a model. Seriously. She was so gorgeous. She was so lean. She was so healthy. And she had this huge goiter. And I figured out that she had Hashimoto's. And my mind was blown because she did not fit the phenotype of what somebody with hypothyroidism looks like. And it had never occurred to me that it could present potentially as like this rail thin. She's like, I can't keep weight on, she's swinging between hyper and hypo. And I was like, oh my God, I think this is what I've been going through for decades at this point. And so I didn't even test. I literally called up my friend, Alex Vasquez. I don't know if you know who he is. He's a brilliant functional medicine doctor. And I was out with him one night and I was like, dude, I think I have Hashimoto's. And he goes, here. And he hands me Cytomel. He hands me T3. Only it's like a 25 microgram dose.
A little too high to start on, but okay.
Right. And I took it. He goes, just put it under your tongue. I put it under my tongue. And about 30 minutes later, my eyes are like this big. I am so happy. Oh, I should add in there, which I think is the most important part. I had crippling depression, take you out. No antidepressants would touch it. 15 years on antidepressants, severe depression and anxiety that could not be touched since I was like 16. All of a sudden, I looked at him and he goes, are you okay? And I'm like, I feel like my heart is racing so fast. I feel like I just drank a pot of coffee. And he goes, yeah, but how do you feel? And I was like, I feel normal. I remember saying those words. I was like, I feel normal. Wow. And that was it. And then, of course, I run my labs. My antibodies are way high. Boom, boom, boom. And I'm just like, and then from that point on, I vowed, so I did all musculoskeletal work, as you know, with the huge focus on regenerative injection therapies. But everybody got screened for thyroid. Everybody got thyroid if they needed it. Everybody got thyroid, even if they were subclinical and their labs didn't show it, but the symptoms did, because a lot of it shows up as musculoskeletal pain in different ways. And I was like, I was like Oprah, like everybody gets thyroid.
Yeah. Everybody gets thyroid.
It would like rule out, it was diagnostic, right? As well as therapeutic. If it didn't do anything, which was rare, I would remove it. But if it would change migraines, it would change frozen shoulder. It would change all kinds of really terrible, debilitating migraines like that nobody could touch. I'm like, I got some thyroid.
Exactly. Well, to your point, how many people are given lithium, an antidepressant, or over on the pain side, like ibuprofen, pain pills, prednisone for inflammation, for frozen shoulder. I mean, there's all these Band-Aids when really, if you just treat the thyroid and give thyroid, oh my gosh, the person lights up and it has that trickle-down effect for the rest of the body where symptoms start to eradicate. I mean, you're eliminating symptoms just by treating the thyroid.
It's a life changer. And really, like you said, treating the T3, making sure, because a lot of these folks come in to my clinic and I would look at them. I could just look at them and I'm like, you're hypothyroid. They're like, no, I'm on T4. I'm like, I don't care. That's making it worse. You're hypothyroid. I could see it under ultrasound, Amie. I would actually put my ultrasound probe down and I would get this really foggy picture underneath. And it was very difficult to really see the layers of the tissues that you should be able to see clearly. And I started asking all of my mentors in the space, like these old guys that have been doing ultrasound guided injections forever. And I'm like, are you guys seeing hypothyroidism on ultrasound? And they were like, what are you talking about? I'm like, it's myxedema. It's this proteinaceous edema. And it's under the probe. I can see it. And they're like, what are you talking about? And so then I started sending my one buddy pictures. I'm like, this is hypothyroid. This is after I treated it. This is like the ultrasound pictures. And so anyway, that's kind of mine was sort of a backwards inside out way of, because I would recognize it in the tissues, which to this day, I don't think gets enough respect. I mean, you rip a tendon before you're menopausal, I should say, because if you rip a tendon when you're menopausal, I'm going to blame estrogen too. But you rip a tendon, I'm like, thyroid.
Yeah.
You have chronic thoracic pain, thyroid. You have migraines, thyroid.
Yeah.
It's worth investigating with somebody who knows what they're doing, but no one knows. I shouldn't say that. Not very many people know what they're doing the way that you do.
I love talking to somebody that has the same mind as I do, because just like you said, like we can treat a variety of conditions with thyroid medication, with proper thyroid medication, not T4 only. Let me say that. But what you just said, your story is actually so impactful for anyone listening, because now they're sitting back going, oh my God, I do have I did, tear my shoulder. I have frozen shoulder. I got diagnosed with that. I got put on pain medicine. I got prescribed high dose ibuprofen. And so, yeah, what you're sharing right now is very impactful, because it goes beyond the weight, the hair loss, the fatigue that we all think of when we're talking about thyroid. And those are the top 3 symptoms. I mean, I talk about those in the book, but then I go into those wild and wacky symptoms that you wouldn't necessarily pair up with thyroid, like migraines and frozen shoulder, that absolutely can be attributed to low thyroid function.
Yep. So many things too like the depression and the manic depression that I was diagnosed with. I think I was just going hyper. I wasn't manic depressive. I was just having a thyroid storm, which was making me really skinny and really buggy eyed. And then I was like dumping, then all that thyroid tissue got destroyed. Now I'm just hypo all the time because I destroyed all the tissue.
Right.
Eventually you just bottom out. But
the nice thing is that we can replace it. So even if you destroyed your own thyroid, that's cool. Like we just replace it with you're on the right blend for you. And we just replace those hormones. But it's getting that diagnosis and having someone like you or I to look at the labs and go, yeah, this is what we're seeing. That's the first part. That's the first hurdle that people have.
Well, my biggest beef, and I know this is yours too, you've done whole episodes on your podcast about it, is first of all, we're in the dark ages. Like the TSH that they consider normal is anywhere between 0.5 and 5, basically. And that's just crazy town. Like I consider 1 normal. I'm sure, you might have a little bit variable, but generally speaking, somewhere around 1, I think we can all agree. But then on top of it, the thyroid has been so vilified as a hormone. Like it's going to kill people if they take it. And I do not understand that. You give someone too much thyroid, they get a little tachycardic, their heart starts racing. They get a little bit of a heartbeat in their ears when they lay down at night. I'm like, back off the dose. We're not giving anybody osteoporosis and a heart attack as we on-ramp them and titrate them up to an appropriate dose. Like what is with the fear? Why has this been so vilified?
I think it all goes back to conventional medicine training. I talked to a variety of different just conventional docs. I even talked to my sister, who ironically refused to be quoted for the book. She is, top level geriatrician, doctor of osteopath, DO. And I wanted to really get her quote, her words on what they learned in med school, and she wouldn't do it. She wanted to go on record of actually stating how very little training they get in med school. I mean, it basically is you test TSH. If TSH is above that 4.5 cutoff on the lab value range, you give T4, you recheck them in 6 months. That's it. I mean, they are literally trained in 5 minutes about the master gland that runs your entire body.
Yep. It's crazy.
Yeah.
I think of hypothyroidism as the way I describe it to my patients is that you're slogging through molasses. Mm-hmm. Like everything feels so much harder because you're just slogging through molasses. And metabolically, your engine's turned way down, right? I had actually a really neat doctor say one time, he's like, it's like you have an 8-cylinder engine, but only 4 of them are working, mm-hmm. right?
I like that.
And you just don't know it. Like that's the worst part. You don't know it. For me, one of my cardinal symptoms is when something that I say all the time, like with patients, I would say have the same script for, as far as like describing certain things. I would have a very, I had not like a generic script, but like I knew how to describe something very quickly and efficiently, and you get very good with your language, right? And mm-hmm. I couldn't get the words out. And it's like that little, I hourglass on your computer or on the Mac. It's like a dial. It's like a wheel, the wheel of death.
Spinning.
That's what your brain feels like when your thyroid's low. You're just like, I cannot get the words. They're not coming to my tongue to come out of my mouth. They're in there. I can't think of them. I'm like, that thing. And then the wheel of death. And everybody thinks that's just typical perimenopause and menopause. But I'm like, no, that's your thyroid bottoming out in perimenopause and menopause.
Exactly. I always say hypo, low, and slow. So if you think of everything slowed down from your metabolism, your digestion, your brain function, your mood, your body temperature is lower, your heart rate is lower, like everything is low and slow. Just like you said, you feel literally like you're going through molasses. Your metabolism is dragging behind you. You have none. That's why you're putting on weight or you're not losing weight no matter what you do. And when you think of it that way, that hypo, low, and slow, that allows people to kind of tune into all of their symptoms instead of writing them off. And to your point, like right now, thankfully, we do have a little bit more of a spotlight on perimenopause and menopause, but it's almost too much. Like we have 5,000 menopause books out. We have 20,000 perimenopause books out. And I'm over here going, what about the master gland that actually determines whether or not that VHRT that you're taking is going to work or not? So yeah, we can talk perimenopause, menopause all day long. We talk hormones. I love hormones. But if you're not addressing the master gland, then again, the hormones actually become a Band-Aid solution, just like the antidepressant and the statin and the sleeping pill and the blood pressure medication. It's no different. You have to treat the master gland first.
Yep, 100%. And if you don't, you'll bonk. And I don't have people ask me, what does that mean? I'm like, you'll know it when it happens. You're like, everything's great. And then about 90 days in, you hit the wall and nothing's working and everything's going haywire. And you just can't put, the hormones on top of a system that is metabolically slogging along. It doesn't go well. It gets more mucky, right? You just kind of muck up the pipes a little bit more, the engine. It's really miraculous too when people get their thyroids treated appropriately. It takes a minute, you got to play with the doses, and this is something where the patient and the doctor, I think, really need to be working together. This, unfortunately, maybe fortunately, I actually wish thyroid was available over the counter, to be honest with you. I think it's that benign and that necessary. I think that we have a whole generation of depressed kids who could really probably benefit from thyroid. I think definitely if we were to give thyroid medication to every single person in an old folks home, in some kind of assisted living, I think we'd see, I think that low-key dementia that we see setting in the elderly is very much a thyroid issue. But it's, getting that dose right takes the skill of the practitioner and the willingness and patience of the patient to get it right. But man, when you do, and it changes every season and it changes through the years, and it's, like you really helped me. I was just on my nature thyroid, like I'd always been forever. And I had done, I go on and off the T3, but I didn't have any T3 on board. I saw you somewhere talking on, I think it was on your podcast or it was on one of your reels. And you said you were really doubling down on something I definitely already know about how T4 can, go to reverse T3, which I want you to talk about this next. I just want to lead in with this little story because you really helped me. And I don't think you know this. The T4 definitely can go to reverse T3 if you're stressed out of your mind, like I have been. And I just ditched the nature thyroid completely and just went straight to T3. I've never been on only T3 as a treatment therapy. And I've been upping the dose, and I feel so much better on it. In so many ways, my pain is down, my brain is clearer. I still have a ways to go to figure things out, but all that to say, it was something I knew, but you're behind the ball when your thyroid isn't working. So your brain isn't optimized. So I wasn't even seeing the obvious in front of me. As you can't doctor yourself, of course.
Well, that's the thing. Yeah, you can't. You can't think for yourself. You can't.
No, but your work really helped me. I was like, oh, a fucking duh, Tina. Just drop the T4 completely. Get the nature thyroid out. Because that's, for the people listening, it's a blend. It's a more natural occurring blend, I should say, of T4, T3, and even T2. And anyway, I got that T3 on board at a higher dose. And all because Dr. Amie you were impassioned on one of your reels, I think. And you were fired up because somebody had
pissed you off,
and you were like, you guys need to understand this.
Sounds about right. Yeah, that's about right. Well, I mean, right now we have so many dude influencers out there talking about hypothyroidism who've never had hypothyroidism. So that's usually what fires me up. I'm like, just stop. Just stop telling women that they don't need thyroid medication and all they have to do is take your master class to heal their thyroid naturally. I know that pisses you off too, Tina. So that's why I'm bringing it up. Like, just heal your thyroid naturally. It's like sometimes you just need the damn medication. So yeah, and it's very nuanced to your point. It's very, very nuanced to each person in each season of life. So where Thyroid, blend of T4 and T3 used to work for you, I mean, that falls in, for the listener, that falls into the NDT category. So Armor Thyroid, NP Thyroid, Thyroid, that's T4 and T3. Great combination if your body can convert T4 to T3. If it can't, sometimes we have to throw in some T3 and change that ratio. Sometimes we need to go T3 only, like you did, Tina. So it really is a nuanced art to dial it in. But once it is, it's like, go ahead and ask that woman if she'll give up her thyroid medication when she's actually feeling amazing. Her brain is working. She's not gaining weight, looking sideways in a brownie, and doesn't want to take a nap at 2 p.m. She's not going to take your master class to heal her thyroid naturally. You're going to have to pry that thyroid medication out of her dead cold hands. But the people that think like, oh, I want to give up my thyroid. Can I go off of this? This isn't even working. Those are probably the people on T4 only, or they're just not on the right combination for them.
It's criminal when I see doctors take patients off their thyroid. I see this most often, and I hate to say it because I am a licensed chiropractor as well, but I'm a naturopathic physician first and foremost, and I have a license to prescribe, and I ain't afraid to use it. But my chiropractor colleagues, back when I was seeing just a ton of patients, when I had my brick and mortar, so often people would come back and say, I'd look at them and I'm like, dude, you're so hypothyroid. What happened? I went off my meds. Why? Well, Dr. So-and-so said I should take the supplement instead. I'm like, let me guess, he sold you the supplement off his shelf after he muscle tested you and you told you didn't need your thyroid. And here you are and all your musculoskeletal pain's back. Your eyes are puffy. It's so obvious when someone's hypothyroid that I've taught my assistant how to identify it. She would go in and when she seated a new patient, she'd bring them in, she'd seat them. She would just do a quick few minute questions and then come back and report the findings to me. And then I would go in and obviously do the full intake and the history and the physical exam. And she would come back and she's like, they're hypothyroid. She just knew how to see it. My daughter knows how to see it. I've taught my husband how to see it now. So it's like, The Sixth Sense, that movie where he's like, I see dead people. I'm like, I see hypothyroidism. And I moved to Arizona because I see a lot less of it here. And I was like, I need to because their brains are not working when they're hypothyroid. Your brain is not optimized. So I joke, I blame the COVID situation, that whole ridiculousness that went down. Mm-hmm. I blame it on hypothyroidism across the board. I'm like, these people are allowed to make decisions and vote. And they're like, I hate to say that, but like their cognition is not, they've got 8 cylinders and they're running on 4. And you're so right. It's so often, or their MD would scare the bejesus out of them and say, well, you're going to have a heart attack if you stay on that because you're over 65. And I would get notices from pharmacists saying, your patient's over 65. What are you doing prescribing them Thyroid? And I'm like, what? Like, I'm the one managing them. We're fine.
Wow. And to your point too, that brings up the immune system. So we know that if your thyroid isn't functioning well, then your immune system isn't even functioning at a top level. So why did we see, so many people being taken out by COVID when it's just a virus? It's just a virus, man-made, but that's a whole other discussion. But if your thyroid isn't functioning well, even your ability to surveillance cancer cells, like your body's ability to seek out and destroy the cancer cells that we all have in our body, FYI, we all have them, but your immune system is constantly destroying them. There are, again, it's kind of like, what is it? Bait, like clickbait, but there are influencers out there that are like, Synthroid causes cancer. I'm like, all right, wait, time out. I don't like Synthroid as a monotherapy, but I'm not going to say that it causes cancer. When you actually break that down and explain it, it's not the drug that's causing the cancer. It's the fact that these poor people on T4 only with elevated reverse T3 and non-optimized thyroids don't have the immune system working enough to destroy cancer cells. So that's why we're seeing more and more when the thyroid isn't functioning properly.
Right. This is, it's not that you're not preventing, treating, or curing anything.
Right.
It's because in my brain and the way that I do medicine, it's never one thing. We have to optimize every system for all the other systems to work and appropriately. And so this is just a big lever we can pull. It's one of the bigger ones, I would say, the thyroid. And we got to pull all of them. But because if you're malnourished, your immune system's going to be off, but your thyroid's going to be off too. You can't starve your thyroid. You can't overfeed your thyroid. There's just a lot going on here, but that is such a powerful lever to pull and to pull it from people. I mean, if you look at the DSM-5, I should back up. The DSM-4, I know this for sure. I don't know what the DSM-5 says. I just know it's come out. The DSM-4, when you apply an antidepressant to a patient and it doesn't work, like usually SSRI will be like first line. You may give them an MAO inhibitor. You apply those antidepressants and they'll stack them sometimes and it doesn't work. It actually says to consider Cytomel and make sure that you address the T3, because the people who have no reaction or very little improvement with antidepressants, very often I have found clinically that they are very hypothyroid. And even if they don't look it, and I give them a little bit of thyroid and either what they're taking works better or we've been able to get them off of those medications because we were addressing the real underlying issue. When people talk about root cause, I'm like, dude, this is about as root as it gets. Like, fix the thyroid.
Yeah. Functional psychiatry will use T3 even for extreme case like manic depressive and schizophrenia. They will use T3 because of the T3 receptor sites on the brain.
Yeah. And I am someone who lives that. I am someone who lives with that kind of symptom picture. And when my thyroid is low, I am so low. I am so emotionally just like drudging through life. And I wouldn't say depression because that's what they have labeled it. It's a different feeling. It's just, you're cellularly, metabolically not revved. Your engines are not revved. They're not revving. And you can't get out of bed. So it looks a lot like depression, but really it's a very flat affect. And it's terrible. It's a terrible place to be. I see it a lot in young people. I can't tell you the amount of young people I've diagnosed with Hashimoto's, teenagers. Parents would come in, usually the mom, I would diagnose them and they'd say, my daughter has all these same symptoms. I'm like picking up clumps of hair from her right around her sink where she gets ready and blah, blah, blah. And I'm like, yeah, bring her in. And boom, she's got full-blown Hashimoto's too. And every patient that came in was like, well, I have Hashimoto's. And I'm like, well, join the club, girl, because don't we all?
Honestly, I mean, and if we back up, we know that Epstein-Barr virus, back up from that, mono. So at some point in time, you had mono, leaves a mark, EBV. EBV is a huge precursor to Hashimoto's. Tina, I've not tested a single person yet who does not have EBV. It's like we've all had mono at some point, whether you know it or not. I didn't even know it. I tested myself. I was like, oh, looky there. Okay. I must have just been like really sick one time in college, maybe just, laid in bed for a couple of days, whatever. But EBV is a huge precursor to Hashimoto. So I think it's safe to say like 80 to 90% of the population has Hashi.
Oh, yeah.
Whether they know it or not. Yeah.
Yeah, for sure. And let's talk about that because people think it's some kind of like special rare diagnosis and it's not. I'm not trying to take away somebody's lived experience by any means and their suffering. I believe it's real. We've just talked about that, but it's so common because there's so many drivers. The thyroid, it's like molecular mimic on that poor thyroid is, talk about that. Like, because this is where people get glommed up. They think they have some special disease. And I'm like, no, your poor thyroid's the body's getting very confused and the poor thyroid's taking the hit.
Yeah, absolutely. So whenever we're talking about autoimmune in general, I love the analogy of a three-legged stool where, on the one leg, you have that genetic predisposition. So you think back, does your mom, your sister, your aunt, your grandma, whatever, have any kind of autoimmune? It can be psoriasis, type 1 diabetes, rheumatoid arthritis, whatever autoimmune condition there is, there's that genetic predisposition. Then, the other leg of the stool, we have leaky gut, which pretty much we all have these days. I mean, with the onslaught of chemicals that we put into our bodies, on our bodies, in our food, frankenfood, depleted soil, the whole deal. Okay, we have leaky gut. Then that third leg is that trigger. And that's that. What can trigger us is huge. It could be something as simple as puberty, pregnancy, perimenopause, menopause, hormonal shifts. It could be stress, death, divorce, taking care of a parent, trouble with your kids. I mean, a move. I mean, all of that. Or it could be a viral infection. That was what I was going to say next. It could be a viral load, right? So those are all the things called life, basically. Life can trigger an autoimmune condition to turn on. And Hashimoto's is just one of those that switch flips so easily because the thyroid is the canary in the coal mine. Yep. It responds to everything, every nutrient deficiency, every stressor, every hormonal fluctuation, basically every thought you have in your head. Like the thyroid processes it. So if you're anxious, if you're depressed, the thyroid's taking that beating. So when we're talking about Hashimoto's, just like you said, it's essentially your immune system going out and beating up your thyroid gland. Like we can see it on ultrasound. It starts looking like Pac-Man attacked it, like jagged, it gets smaller. And I always say to people, listen, if I came over and beat you up every day, do you think that you would do your job well? Would you be a good mom, a good parent, a good spouse, whatever, a good friend? No, you'd be dragging ass. You would want to lay in bed and not do anything. That's your thyroid. It wants to lay around and not do anything because it's getting beaten up on a daily basis when you have Hashimoto's. And Hashimoto's goes undiagnosed so often. I mean, how many times have you seen your patients come in with no antibody testing, or a doctor will run like 1 out of the 2? And I'm like, hello, there's 2 antibodies that we want tested here. Your doc only tested 1 and called it a day.
Every patient. I mean, because this was, I think people are talking about it more now, but functional medicine and naturopathic doctors were really we were just quacks. We were just considered quacks back in the day. So, nobody ever had their thyroid antibodies ran. I run them first and foremost on every single patient. And some people would argue with me, but the reason I do it is this. They're inexpensive for the most part. And when you start running antibody panels, like you're looking for autoimmune disease in general, those can get quite expensive quite quickly in the grand scheme of things. So if people aren't using insurance, and I actually don't want this to show up on people's insurance, to be totally truthful with you, I encourage people, I always used co-ops, lab co-ops. So people would pay, my practice was never insurance based. So it was, payment at time of service. This allowed them to get labs at a very ridiculously reduced price. It didn't have to show up on insurance. Nobody knew the wiser. It was just in our chart between us. And because if their thyroid antibodies were elevated, I was like, welcome to the rainbow. Welcome to the autoimmune rainbow. I'm dealing with somebody's usually musculoskeletal pain, in most of those cases, chronic musculoskeletal pain. And so I'm trying to figure out how immune driven this musculoskeletal complaint is, because I would say most musculoskeletal complaints are immune driven. If it's not a frank, overt injury, it's probably to some degree immune driven. And so this was our flag. We would have I'm like, okay, now we treat as if autoimmune, because that's kind of a little bit more diligent dietary and lifestyle recommendation situation, and patients aren't always keen to do it. But if you have something objective, you can show them, like, you have elevated thyroid antibodies. This is not going to get better until you change quit drinking, quit smoking, or at least cut back the booze, quit smoking and cut the gluten out, whatever. Anyway, so I ran thyroid antibodies on everyone because I was looking for that canary in the coal mine. It was the flag that would give me the indication, if it was clinically indicated based on their history, that maybe we should start looking for those viral titers of different, we should start looking for infections, definitely treat the gut. But it's a really inexpensive way to find out kind of your overall situation, I would say.
Oh yeah, absolutely. And antibodies can come back as a false negative for, on a couple different tests. I mean, we might be testing someone, it'll be 0, 0, 0, and then bam, they're there. And it's not to say that Hashimoto's just occurred. There are conditions, it's called seronegative antibodies, that we'll see a 0, but we know that that person has autoimmunity.
Mm-hmm.
Like we know that that's the driver. Now, that being said, too, it doesn't really change how we treat you.
Right.
We just want to know, like we want to know so we can really put the hammer down and make you go gluten-free and control your stress, because those are all the things, like you said, molecular mimicry. Whenever you eat gluten, that's kicking up a thyroid storm. It's kicking up your antibodies basically to attack your thyroid. So I try to explain that to my patients. I explain that in the book, that every single time you just say, oh, screw it, I'm just going to eat the piece of pizza with gluten in it, and you have Hashimoto's, you're literally building your army of soldiers that like to go out and attack, and you're literally launching that attack. So knowing that someone has Hashimoto's, just we get a little bit tighter, but it doesn't change what we're doing on the thyroid treatment side, because for those, we're looking at the important numbers, free T3, reverse T3, and we're adjusting that way.
Right. It just gives us hopefully a little bit better compliance out of the patient, because we want them to do those things anyway in general. So now we have some numbers to show them.
Yeah, exactly.
Yeah. I also think that the hair loss we saw with COVID, everybody kept messaging me and they're like, oh, my hair's falling out after they had COVID. I really think COVID, and I've said this a million times before on this podcast, I think COVID pushed people over the edge they were already on. So the cliff they were already on. So a lot of people were already hypothyroid, undiagnosed. Nobody, and what, 90% of people with women with hypothyroidism have Hashimoto's. So if you've been diagnosed with hypothyroidism, there's a very high likelihood you actually have the autoimmune version, and COVID just shoved everybody over. If you were on the edge of menopause, COVID shoved you over. If you were on the edge of hypothyroidism, it's usually a mixed bag, COVID shoved you over, and then all your hair falls out and you get thrust into menopause and you're like, what happened? I feel so awful. Is this long COVID? I'm like, maybe you were just on the edge of something and it was like, here you go.
She's going to kick you right off that edge.
So I don't know. I mean, what are your thoughts on that? Because I feel like that a lot of people just went real hypothyroid after that.
Oh my gosh. Absolutely. And it's hard to say. It's like, did that viral load kind of tip the scale and allow that switch to turn on? And that was the first time it turned on, maybe. Or was someone really hypothyroid to begin with? Then like you say, COVID happens, it pushes them over the cliff. Now they're really noticing the symptoms come on. Like now they're paying attention. Whereas before, okay, it might have been a little bit of hair loss, a little bit of weight gain, a little bit of low energy. And now it's just exploded to where it's affecting quality of life. Yeah. And that's what the thyroid does. I mean, it will affect your quality of life.
Absolutely. Oh, in so many ways. Gosh, I was at the gym the other day and I saw so many women there that had low functioning thyroid, and they were just crushing themselves on the treadmills and the rowers, and like no one's lifting weights. They're just all over there like crushing themselves on the cardio. And I'm like, God, this is the same thing that's been going on in the gym for decades. Has nobody learned anything? And I'll say this, and I'd love to hear your thoughts. I think you're going to agree with me. Giving thyroid to a patient doesn't necessarily mean they're going to have weight loss after.
Right.
And that's really frustrating for people, because they think, oh, well, if I get the thyroid, then the weight will come off. Or if I get the HRT, the weight will come off. And that doesn't usually work out that way, but it does seem to abate the consistent weight gain that was happening. What are your thoughts?
Right, exactly. Well, I mean, the bottom line is if your thyroid isn't functioning well, and specifically if you don't have enough T3, like we've been talking about, the active thyroid hormone, or maybe you are being treated for your thyroid and it's being treated improperly. You're given too much T4. I mean, just like Dr. Tina said, when she was on Nature-Throid, that's 80% T4 and 20% T3. Even though, okay, yay, there's some T3 in there, that was too much T4 for you. So that pushed your reverse T3 too high. So whenever someone is in that space of elevated reverse T3 and or low free T3, you're going to have a slow metabolism. I mean, across the board, you have no chance whatsoever of losing weight. And you probably will continue to gain weight if those markers are off. Then we start treating you properly. And then it becomes, okay, that's going to help with the metabolism. But now what else has been thrown off through the decades that you've gone mistreated or undiagnosed? Are you now insulin resistant? Are your hormones low? Is your cortisol functioning wonky, like it's too high, too low, whatever? So we have to look at all the other factors that play into metabolism and weight loss in addition to thyroid. You're right. Just giving thyroid isn't the be all end all. And how many pop-up clinics, these silly on the corner hormone pop-up clinics will hand out thyroid like it's candy for weight loss, but then never check somebody. And I think that's really where it's getting the bad reputation, is like, oh, here's some thyroid for weight loss. It's like, wait, no, we want to optimize somebody and look at all of the factors contributing to their weight, not just hand them thyroid and tell them this is going to fix them.
There's always so many greedy pop-up clinics, whether it's GLP-1s, whether like the whole microdosing conversation that got completely destroyed. My whole strategy has been co-opted, manipulated, and twisted into some crazy whatever. And there's always it's always something, right? But at the end of the day, if you take a fragile person who, I think this is the same with GLP-1s too. If you take an individual who is really metabolically compromised, their system is sluggish, their thyroid is sluggish, and then you either hit them hard with thyroid, or you hit them hard, what's more often happening, you hit them hard with GLP-1. It's the entire ecosystem of your body, including your vascular system, everything, your nervous system, all of it is dependent on thyroid working properly. And all of it has thyroid receptors. So these people get hit with these copious amounts of GLP-1s and sort of sent on their way. And then they wonder some of these terrible side effects that people are having. I'm like, I guarantee that patient was hypothyroid. I guarantee that person who experienced blindness and or gastroparesis and or any other slew of the things that everyone likes to scare you about with them, the dose of the GLP-1 was too high. And I guarantee you they were hypothyroid and it was not addressed.
Or the GLP-1 won't work.
Right.
I've seen that too.
Yeah.
Because of the thyroid. Yeah. The thyroid's low and slow. GLP-1 won't work. People are wasting money.
Yeah. And it's really frustrating, I'm sure, for the patients. And I'm sure it's frustrating for folks to try to figure out how to, navigate this. But like, it's such an obvious one to me. And I'm just sitting there like, oh, and then of course they come into my DMs and they're like, GLP-1s are killing people. You're a shill, on and on with all the nonsense. And I'm like, well, you guys are like, I can't, this is why I had that course, the GLP-1 done right university, because I couldn't teach functional medicine to people and teach them about GLP-1s. This is a combo. We need all the things working. This is, we dial in, I personally dial in adrenal first, then thyroid, then HRT, then we apply the GLP-1. We may apply the GLP-1 earlier in the schematic as we're going along, so long as we are in congruence and we are working together and we are moving towards the same place, right? And the patient's doing their due diligence, which is all the things. You can't just people out there. You can't just take thyroid and expect the miracles to happen. It's just like GLP-1s. You have to go to the gym. You have to eat nutritionally dense food. You have to make sure you're dealing with your sleep and your stress. Like, talk about that. Because that's the part people also, my patients will be like, I don't know why it's not working. And I'm like, because you sit on your ass all day and you're not doing anything and you're eating Cheetos. That's why.
Exactly. Well, yeah, it's that whole foundation, whether we're talking about thyroid hormone or BHRT hormone, you have to have that. You can't put those beautiful hormones on a dumpster fire. You got to have that foundation. You got to at least be taking care of yourself, controlling your insulin, everything you just said, sleeping, all the things for that hormone to work, for that thyroid hormone to work in your body. And the thyroid hormone, whatever it is, T4, T3, T3 only, whatever combination we find for you in the dose that works for you, needs nutrient support. So we have to have the basic key nutrients, the zinc, the mag, selenium. I'm a huge fan of iodine. I know that's controversial, but I believe that that's essential as well. We have to have that on board. You can't be eating processed foods. And again, like throwing hormones on a dumpster fire, not going to work. But when you do all the things, it's like a synergistic symphony. I mean, it all works beautifully together and you will get results a lot faster when you have that foundation going on and supported of the thyroid.
Yes.
Yeah.
It's all the things. And it's really let me back up and let me say this a different way. if you're listening and this is ringing a bell and you're like, this is my problem. I got to go see Dr. Amie and get this addressed. What I really want to emphasize, this is why I brought it up, is there's so much work that you can do on your own to really optimize your system so that when those hormones are applied or those GLP-1s are applied, it works beautifully. When I have a patient come in who's like you or like me, and they're relatively fit and they eat relatively well and they're doing, all the things, and they're like, we find out they have Hashimoto's, and you give them a little sprinkling of some thyroid, and it's so much easier to get the dose right. It's so much easier to get them optimized. It's so much easier to use the, littlest amount of GLP-1 necessary or the HRT versus somebody who is just a hot mess of inflammation and metabolic dysfunction. And those people, it's like chasing a moving target, right? And everybody's frustrated. And these are the people we see in our comment section who are like, I've spent so much money on functional medicine doctors and blah, blah, blah. And I'm like, are you going to the gym?
Right. Something simple.
Morning sunlight, basics,
Exactly. And to your point earlier, you were talking about reverse T3, that all of those things that you just said drive up reverse T3. So reverse T3, essentially, it's a marker we want to test, but it puts your body into this lockdown survival mode. And the way that I describe it is T4 has to convert into T3. So it has two paths that can go down. Even the T4 that your own thyroid gland is making, it can choose to go down the path of and become free T3, the active thyroid hormone. We hope it does that. That's what the body is supposed to do. It's supposed to take that T4 and convert it into T3. But it has this other path it can go down called reverse T3. If it goes down that path, your body literally thinks that you are lying in the ICU or the ER fighting for your life. That's what reverse T3 is built in us for. Because when we are injured, when we're in a trauma state, when our energy resources of our body needs to go to healing or keeping the heart beating or keeping the brain alive, our bodies know that. And our bodies know in that time of crisis, you don't have to burn fat. You don't need to make major decisions. You don't need to grow your hair. You don't need to poop every day. You just need to lie there and survive.
Yeah.
But what if reverse T3 is elevated when you're not in the hospital? Now that becomes a massive problem. So your body literally thinks that you are in this lockdown mode. Well, what are the drivers of reverse T3? Elevated insulin from eating like garbage, elevated cortisol. You're all stressed out and wigged out, or you just have environmental stressors that are throwing off your adrenals, your liver, your gut, huge places of conversion. So how many livers are gunked up? How many guts are messed up? There's so many micronutrient deficiencies. There's so many things that get in the way of that T4 to T3 conversion that, to your point, you have to do what you can to clean up the house first. And then we work on adding in that thyroid hormone. And yeah, we can bring down your reverse T3 if you're doing your part, but you got to do your part.
Yep. And your muscle, is a huge conversion site. Active skeletal muscle is a huge conversion site of T4 into the active form of T3. And that's something that is highly neglected. I have given lectures in front of medical doctors on stages about this, and they want to poo-poo me because it was like 10 years ago. I'm like, you need to eat steak and deadlift. They were like, yes. Who is this quack? So I'm vindicated because it turns out I was correct. But it's the spark, right? Like it works. Everything just works so much better. I just went through that, Amie. I was, my mom was sick, and I've shared this with my audience. She was really sick. She was a lot sicker than I've let on to everybody publicly. And it was real dicey there for a minute. And interestingly, with cortisol, I call it coming down the mountain. Do you know that? Were you ever a fan of Jane's Addiction, the band Jane's Addiction?
Of course, yeah.
Their mountain song, like coming down the mountain, and then it crashes. The song crashes. That's how it feels. So
that's it.
You're like cortisol, and I'm running on cortisol, and everything is okay because I'm on so much cortisol. I can't think straight. I'm just like taking care of my mom. I'm taking care of shit. I'm handling it. I'm on cortisol. And then all of a sudden, the crisis is over, and coming down the mountain, right? You just crash hard, and boom, I gained 10, 15 pounds just overnight. And my daughter's like, Mom, you have body dysmorphia. I'm like, Zoe, none of my pants fit. Like nothing fits. I am in all dresses all day because literally nothing fits. And I know it was just a cortisol overload, but that cortisol overload just destroyed my thyroid function. So of course I get the bumps on the arm and I get the course. I mean, we should talk about that because like if your thyroid is low, your keratinocytes aren't turning over. So you end up with cystic acne, you end up with the bumps on the arm, you end up with rough, I get rough outer thighs. I just get rough skin everywhere. I get that, I've seen dermatologists on Instagram talk about that fishy skin that people get on their shins.
Yeah.
And they're like, oh, it's a vitamin deficiency or it's this or it's that or you need more moisture. I'm like, no, that's a thyroid symptom. Ingrown toenails are a thyroid symptom because the keratinocytes around the nail bed won't shed. They just build up and build up and build up. And I can't tell you how many young people I've helped with chronic cystic acne. You give them some thyroid and all of a sudden the cellular turnover starts and the cystic acne starts to resolve significantly. So it's, chronic stress will wreck you. It just wrecked me. And the older I get, the less tolerant I am of it. I told my husband, I'm like, I'm out of my 9 lives. I can't have one more no big crises for a while. I can't.
Seriously, I know your body doesn't need any more. But you know what? You bring up a really good point that's worth mentioning. How many people, and even our listeners, I know this, will go, okay, it's my adrenals. Can I get an adrenal supplement? Like I just need to fix my adrenals, where it's like, it started there and now it's your thyroid. So you can fix your adrenals all you want, but now your thyroid just took a hit. And if you don't go and address the master gland, you can throw all the adrenal supplementation, do all like the adrenal cocktails, meditate, whatever. And your thyroid's still going to be in the toilet because you just went through a major stressor.
Yeah.
So, yeah.
Yeah, I had to up my T3 dose. I had to crank it up for a few days there until my lights turned on. That's what I do. I work on my medication until my lights turn on, and then once my lights turn on, I know what to do. But I can't when I'm behind the ball. I can't see it. All you do, you're like swimming. It's like the never-ending story when he's in the swamp of sorrow and his horse gets sucked in, and you're like, core memory. You're just devastated I was like an 8-year-old girl crying in the theater.
Yeah.
That's how hypothyroidism feels. It feels like the nothing of the never-ending story. It feels exactly like the nothing, and it feels like the swamp of sorrow where your horse gets sucked. That's exactly.
Swamp of sorrow. I love it. Oh my gosh.
And you can't see until you're out of it. And then you're like, oh, okay, I know what to do. But there's a lot of people. There's so many people out there dealing with hypothyroidism right now and getting no help. And it's heartbreaking because they're living a subpar life and they're physically in a subpar state. And it's just your work this book is so important. I hope everybody goes and reads it and comes to your clinic and comes to see you because this is it's heartbreaking.
I know. And that's why we are trying to scream it from the rooftops. I appreciate your help getting the message out that it's like, please, life is meant to be lived to the fullest. Yes, stressors are going to happen. Parents are going to get sick. Stressors will happen. But Tina and I are telling you all that you can absolutely live a bright and vibrant life. You can have energy. You can control your weight. You can poop every day. You can grow your hair. Your brain can function when you address this master gland. It really is possible. So if you have symptoms, anything that we're talking about today, pay attention to those symptoms. They're little warning signs that your body is giving you, and don't dismiss them. Don't medically gaslight yourself either. Don't blow it off and go, well, I'm just aging. Well, I'm under stress. Because, you could do that. You could be like, well, better. But let's say an average person just went through what you went through. They'd be like, well, it was stressful. So that's why I gained some weight. And that's why I feel kind of sluggish. Well, yeah, it was stressful. And now that stress just hit your thyroid. So you don't have to continue feeling sluggish and gaining more weight and fighting the weight that came on. There's an answer. There's absolutely an answer.
I'll share this. I'm being super just open today. I told my husband when I first met him, I said, if I'm coming unglued, in any way, shape, or form, whether it's because I have chronic pain and it ramps up sometimes and it is like takes your breath away. It's so bad. Whether it's the pain, whether I'm acting like a crazy person and not making sense, whether I am terribly depressed and in the hole, whatever it is, tell me to go take my thyroid. That is our deal.
I love it.
And so he has it written down in his little book he has all of his passwords in a little book, and he has that written, like all the symptoms I just listed off and a few others, thyroid and underlined. And so I kid you not, the other day he was like, do you need to check on your thyroid? Because I was like, none of my clothes fit and I gained so much weight from this stress and I was crying. And he's like, do you need to check on your thyroid? I was like, yes, I do. Thank you. So that's how important it is that like a doctor who knows all this has to tell her husband that's the emergency shoot. Like when in doubt, get some thyroid and Tina, and she'll usually figure it out. Just my lights will turn on and I'll, like I said, I'll know what to do next. So,
but it's true. I love how you shared your stories though, because that's the message right there. Like your stories, that's the message. It can be that simple. Yeah. It really can. Yeah.
It's the difference for me between the lights off and the lights on. When I was 15, I don't know what happened, but my lights went out. One day it was like somebody flipped a switch. It was honestly like a breaker blew. And I went from being a happy, well-adjusted kid, smiling, active, really, really high intellect, like AP everything. I was that girl. And the lights just went out on me and I fell into the worst depression. And unfortunately, it was the year Prozac came out. So I spent the next 15 years getting antidepressants shoved down my throat. And that was my big journey going into medicine, was trying to figure that piece out. So that didn't have to happen. I know I don't talk about that stuff much, but like that's a huge part of it. When I look back at my photos from then, it is so evident that my thyroid dumped out at that exact age. And who knows why. I started smoking then. I was hanging out with the wrong kids. I started drinking alcohol then. I mean, I just rebelled because my parents moved me out of the sun. They moved me from Southern California to Oregon. And about a year in, I just completely fell apart. And a lot of it, I think, to do was the sun. The sun makes my thyroid work a whole lot better. That's why one of the main reasons I moved to Arizona. But I just looking at pictures now, I can see it clear as day. And when I think about any of the times in my life when I was just really having a hard time, it's so obvious that I was hypothyroid in photographs. So I just share that because once you see it, you can't unsee it. And when you're in it, it's hard to see. But if folks out there can start paying attention and find somebody to work with, even if it's not Dr. Amie, just finding somebody to work with who knows what they're doing, who's willing to prescribe the hormone adequately, correctly, and not just brush you off and say, oh, you're fine. Because the TSH, that huge range, I heard somebody describe it like this, and you can steal this and use this on the rest of your interviews. I've heard it described as like, you're a size 7 and you go to the shoe store and you say, I like this shoe. It's cute. Would you have this in my size? And they come out and they put a size 12 on your foot. And you're like, but this doesn't fit. And they're like, yeah, but it's within the range. And you're like, no, I wear a size 8 or whatever. No, it's within the range. Deal with it. Or they bring out a 5 and you can't fit in it. And they're like, too bad, you're within range. That's the normal range. And you're like, but it doesn't fit. And now I can't walk. Yeah. Like, that's what's happening in thyroid land with most doctors.
Exactly. I mean, there's so many people. There's listeners right now who have a thyroid problem, but they're undiagnosed because their doctor only checked TSH.
That's probably most of the people listening. That's why I'm like beating this, because I think most of the women, I'm sure you get a bazillion DMs a day too. I get so many DMs. People like send me their novels of their entire health history for some reason. And I can't respond, but it's not legal and it's too much. But 99% of the time, if I do click through to their profile, I just look at them and I'm like, oh, it's her thyroid.
Yeah.
Their thyroid's off.
Yep. You can see it, the myxedema, the swollen face, the moon face, the thickening. Like if you're looking at yourself and your face, like it's not just fat. It's literally like a thickening of the face, of the neck, of the skin, back of arms. It's thicker.
Yeah. Look at Winston Churchill, Al Gore, Carrie Fisher,
Kelly Clarkson is
Kelly Clarkson.
Rachel Ray, I want to help her.
Stevie Nicks. I know. Rachel Ray, Stevie Nicks. If you watch the movie or the show Mad Men, I don't know if people have seen that show, but Peggy, I think it was season 1, Peggy went hypothyroid after the birth of her first baby. And that beautiful girl the actress that played her, they probably had to put a suit on her, but she got really heavy set. And I was like, I just want to give poor Peggy some thyroid.
Yeah, exactly.
It's really, and you end up, this is what really convinced me to take action on it and not be afraid of, because I didn't want to take thyroid hormone for the rest of my life. I was like so many of my patients, and I'm sure your patients, they're like, I don't want to do that. Why if I start this, do I have to stay on this? I saw Dr. David Brownstein. He came to my school to give a lecture at Grand Rounds, and he showed a study. This is back in like 2006, he showed a study in women in particular, if they were subclinical hypothyroid, meaning their labs look normal, but symptomology was there, 256% increased risk for dying of a heart attack.
Yeah.
And I was like, give me the thyroid.
Yeah.
And I just lost my aunt last year, and she was so hypothyroid. I don't have this diagnostically, I'm saying from looking at her, I could tell she was so hypothyroid. I come from a long line of very hypothyroid people, and we thicken up real fast. That thickness you talk about, you've seen it on me. And if you guys go back through my Instagram, just scroll back, you'll see it. You'll see exactly what we're talking about. There's a thickening that happened, and people are like, oh, you look so good now. I'm like, that's because I'm in the sun and my thyroid's working because I'm taking adequate T3. But she had a heart attack, and my dad has been so beat up about it, and he's so confused as to why. And the whole time I'm like, dude, she's been hypothyroid forever. Their mom, my grandma, she ended up in a assisted care facility with severe dementia. And the whole time I'm like, would somebody please give her some thyroid? She was so hypothyroid. Visually, I could see it. And so, this is personal, Yeah,
I know it.
That's crazy. I joke, if there's ever a zombie apocalypse, I told my husband, I'm like, you're going to find, we have a big plot of land back that's like a nature preserve that I never go in there. But that's where I found that baby raccoon last year, remember?
Yeah.
The abandoned baby raccoon. She's all grown up now, living with a lady, and she's so cute. But anyway, I told him, I'm like, you're going to find, I call it the back 40. I'm like, you're going to find me in the back 40 sucking thyroid glands out of squirrels.
Yeah.
That is how critical that hormone is to me, to feeling good.
Yes. Or you just stock up right now on all kinds of thyroid hormone like you and I both did.
Oh my gosh. Yeah. Right. Yeah. So I know time is short and you got to go. Is there, besides obviously go buy the book, The Thyroid Fix, that will be out by the time this episode comes out. It'll be out. Direct people to all of the things, to all the places.
Absolutely. So you can go to thyroidfixbook.com. All this week, we're still offering all the bonuses that you get when you buy a book. So you'll get an invite into the VIP Zoom room. We're doing an all-day live launch party on Saturday, May 16th.
Fun.
So that'll be a ton of fun, giving away like $10,000 worth of prizes. It's going to be crazy. It's going to be a lot of fun. And listen, if you're listening to this and you're like, yeah, I just don't know. I don't know whether I have a thyroid problem or not. It's kind of ringing true to me. I have the symptoms. I'm hearing what Dr. Tina and Amie are saying. Get the book. Yes, 100% get the book. But go join my Just Fix Your Thyroid Facebook group, because in there, you can literally post your labs. You can post your symptoms. My nurse practitioners are in there. I have patients in there that have been with me for years that they'll jump in and they'll be like, okay, so Tina, your reverse T3 is way too high here and your free T3 is low. They will give you feedback on what to do next. So if you're not sure, if you can't even diagnose yourself based on this conversation, go join the Facebook group. We're in there to help you too.
I love it. And then where can they find you on Instagram, YouTube, all the places?
All those things. Yeah. The website is just dramie.com, DRAMIE. But on Instagram, it's the full name, Dr. Amie Hornaman. Same thing with YouTube, Dr. Amie Hornaman. So DRAMIE, and then my last name spelled out.
And the book, again, the book website, say it again.
Thyroidfixbook.com. It's on Amazon, Target, Barnes & Noble. You can go right there if you want. But if you go to thyroidfixbook.com, that'll give you the instructions. Hey, once you buy it, shoot your receipt over, and we'll give you that VIP link to the Zoom room on the 16th.
I love it. So fun. Yay. Well, this has been such a great convo, Amie. I love your work. I'm so glad that, thyroid was a kind of a big deal online several years ago, and it kind of lost the notoriety. And then I met you and I was like, she's bringing it back. This is
We
so
need to bring it back.
important. Yeah.
Thank you.
Well, I love you, lady. Thanks for coming on the show. And I hope everybody goes out and buys your book, The Thyroid Fix. I'll make sure I'll share it out on Instagram too. This is really important, you guys. So, and go check out Amie's work, and we'll make sure that all the links are in the show notes. Thanks for listening to the Dr. Tina Show. This is a Wellness Loud production produced by Drake Peterson. Theme song is by John the Guilt. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.